What's on my mind? I think last month I said something similar, which is the people of Weill Cornell medicine, and I'm going to stick with that theme. The community of Weill Cornell has been amazing to me and my wife since we arrived in September of 2023. You've given us great recommendations for the best pizza in New York. You've told us where to shop. You've told us where to go out to eat. You've told us the great things to see in this great city. And so as I enter into my M3 year, I think constantly about the people in our community. That's what's always on my mind. This is a difficult time for those of us who are in higher education, in particular for those of us that are in the science-based aspects of higher education, because we have great uncertainty about grant funding. We have great uncertainty about how do we support science in the years ahead. So I am always thinking about what are the people of Weill Cornell thinking about so that perhaps I can help, I can lend some insight, I can try to assure everybody that as a 127-year-old medical school, we're not going away. We may look different, but we're not going away. Oh, I had a great time meeting with our new residents who were just arriving at New York Presbyterian Weill Cornell Medicine a few weeks ago. As often when I meet with new residents and new trainees, I remind them of a couple of things. Number one, and most importantly, congratulations. You're no longer a student. You're here as a doctor and really beginning your professional journey as a doctor, something that you've been on a long road for. Secondly, I remind them that while this new role comes with enormous responsibility, don't think that that responsibility all lies just on them. In fact, I remind them that there's many of us here who are keenly aware of the fact that they just graduated and that they need help, they need assistance, they need oversight, they need counsel, and many of us are here to help them with it. Finally, in terms of trying to break the ice a little bit, I tell them about some of my experiences that I remember from my very first day of internship at the University of Massachusetts Medical Center. And it usually gets a few chuckles when they realize how far behind I was on day one. As we enter the artificial intelligence age, we better be preparing our students and our residents and our faculty to be prepared for diagnostic and predictive medicine. I would say if you look at our medical school curriculum, you're going to be hopefully energized, maybe a little surprised at how much we're building artificial intelligence into the curriculum so that they can begin to understand how do we use these new tools and advanced computation to diagnose patients, to predict outcomes. One of the things I talk about a lot is that we need to make sure that our young doctors, heck, we have to make sure that our older doctors are comfortable with these notions of advanced computation that can really help us predict the outcomes of patients using a variety of disparate data sources, whether that's pulling together genomic data with imaging data, with electronic health record data. All of it is things that come together that allow us to both diagnose, hopefully a little more accurately than we have done over the years, and maybe equally important, how do we predict? How do we predict the course of a disease, of a syndrome, of a procedure in ways that we never could have done before? So yeah, big emphasis, particularly on the computational pieces of that. Making tough decisions. That is a leadership lesson that I'm still learning every day. But maybe the way I approach it is a couple-fold. One of which is I really believe in the notion of data-driven decision making. And so when I'm going to make a tough decision, I want to make sure that I have all the data that I need to make that decision. And I will delay making the decision if there's data that's a little more challenging to obtain, to analyze, to understand. The second thing I do is make sure that I get a variety of opinions from different people. I like to get opinions from people who I know are going to approach the problem differently than I might be approaching the problem. Now, I'm not saying that you abdicate your responsibility when you make a difficult decision to the crowd, but those external, sometimes words of wisdom to me are very, very valuable. So data coupled with other people's perspective. And then thirdly, I rarely will make a tough decision in a last moment. I really like to think about things, to reflect upon things, to sleep upon it, to come back to it with a fresh set of eyes. So I take my time if I'm making a quick decision. Again, it doesn't mean that I'm delaying things. If you have to make a decision in the moment, I'm an interventional cardiologist. I'm used to doing that. But I prefer data, perspectives, and time. This is a timely question for the age in which we're living. And I would tie this back to what I've said about making difficult decisions. And a lot of what I do in making difficult decisions applies to how I give both myself advice as well as others who ask me for their interactions with policymakers. How do you do that? I think when you meet with policymakers as a clinician or as a scientist or as an educator, what you should do is come armed with data. You want to make sure that you understand the topic. You want to make sure that you can articulate the data that surrounds that topic. Secondly, you want to make sure that you've seen the problem that's trying to be solved through policymaking from a variety of lenses. So I tend to do a great deal of reading about different ways of viewing the problem that the policymakers are trying to address. Never come to a policy discussion thinking that only your way is the right way, because that's rarely true. And instead, you're better off to have done a lot of literature searching, a lot of reading, and trying to understand the lens through which the policymakers may be thinking of it. Perhaps that's different than yours, and that's what informs a good conversation, a good debate. And thirdly, as I said, in making difficult decisions, take your time in preparing your dossier for when you're going to meet with policymakers. Make sure that you understand the data that you have. Make sure that you've read a lot about the background information that's needed to understand maybe the quandary that the policymaker finds themselves in and is trying to solve. So, like I said, with difficult decisions, data, perspective, and time, really important elements. How do you teach people to have an entrepreneurial mindset? In many ways, you could say you can't. Some people are inventive, innovative, and creative, and other people are not. But I don't believe that. I think that entrepreneurship is actually something that can be taught. This may in part reflect my time out west, where I really learned the benefits of design thinking, trying to understand what the needs are of a particular group of people or of a particular problem set, and then work backwards. Don't invent for the sake of inventing. Try to meet a need. And to meet a need, you have to really understand the needs. And you have to understand the needs for people who are dealing with that need every day. Great example, in the biodesign program at Stanford, where I was previously, the students who were in biodesign spent an enormous amount of time embedded into clinical groups, trying to understand what are the needs of that clinical group, and then inventing to meet those needs. I think that the great entrepreneurs, yes, some of them stumble upon an invention, some of them stumble upon a great discovery, but most entrepreneurs go into this with trying to solve a problem. And if you're trying to solve a problem, I think that's the way to teach people to be entrepreneurial. The next thing I'd say is that you have to have people in your midst who are entrepreneurs, who are innovators, who are inventors, because it's that perspective of having been an inventor, having created something that then can be delivered to others, whether that's through formal mechanisms like classes or informal mechanisms like mentorship. You need people who have done it before in your environment, in your culture, to really help build an entrepreneurial culture. And that's maybe the final thing I'll say, is that entrepreneurship thrives best in a culture that's supportive of its activities. When I first saw this question about staying cool, I thought you were referring to a state of being, in which case I was going to say, I have no ability to stay cool. My children have told me that over the years. But if you're reflecting upon the summer heat, I'm still trying to figure that out. 23 years in North Carolina, now my second summer in New York. I don't know how we stay cool on the East Coast with high temperatures and a lot of humidity. But all joking aside, I'd say that the way to stay cool in the summer is really to slow down. Take a moment, catch your breath, take a few days off, go on vacation, come back energized later in the fall. Summer heat is there for a reason. Slow down. And I think that we could all benefit from that sort of advice.